Hello, everyone, and welcome to the webinar, Get Ready for the IHE North American Connectathon Week. This is an introductory webinar for new and previous participants. Thank you all for joining us today. I'm your host, Emily Lemus, Senior Informatics Specialist at HIMSS and Project Manager for IHE USA. The webinar today will be recorded and posted in the link displayed on the screen. We will be hosting a Q&A session at the end, but in the meantime, please feel free to add any of your questions in the chat feature in Teams. We have a great agenda with some great speakers. Today, Christina Caraballo and David Kwan are going to welcome us and do some opening remarks. Attila Farkas is then going to talk about the venue and location of the event. Chris Carr is going to give us a quick introduction to IHE and its history. Then Daniel Barazanu is going to get into the weeds and talk about the IHE Connectathon and Plugathon testing event. Then Attila Farkas is going to talk about the Pan Canadian Projectathon, and Christina Caraballo is going to bring us home and talk about the IHE North America Experience Days. Again, we will be hosting a Q&A session at the end, so please feel free to use the chat feature. And with that, I'm going to go ahead and pass it over to Christina and David Kwan.
Excellent. Thank you, Emily, and welcome all. This is an exciting year for the North America Connectathon. For the first time in IHE USA's rich history of bringing you the North America Connectathon, we are coming to Canada. This move is reflective of the strong partnerships and collaboration we have cultivated over the past few years as we reimagine IHE and the unique services we provide to the community. For our US participants, you can expect a similar experience, but bigger and better with expanded testing options. Truly partnering this year with our Canadian colleagues has brought so much energy and new ideas to the North America Connectathon Week. And Emily, if you could go to the next slide. I want to extend my gratitude to the Canada Health Infoway, a benefactor of IHE International, for their generosity in hosting this event and commitment to advancing digital health. I want to also recognize contributions and support from IHE Catalyst, RSNA, and HIMSS. The whole North America Connectathon team is looking forward to welcoming and collaborating with our global community in Toronto. Now I'd like to introduce IHE Canada Chair David Kwan to provide opening remarks.
Thanks, Christina. Welcome, everyone. Canada has had a long legacy of contributing to healthcare information technology and systems interoperability. This event is a huge opportunity for Canadians to continue evolving and applying modernized approaches to healthcare systems interoperability. Interoperability seems to be the current buzzword among media, industry, and government messaging. To truly achieve seamless systems and data interoperability, we must not confuse this with systems integration. To be systems and information interoperable. Achieving systems interoperability is not easy. It takes a community. Declaring that we shall use this standard or that standard in a complex world of healthcare IT, what we need is to take a coordinated approach to technology and testing in the implementation of various healthcare interoperability standards and systems. Canadian technology leaders, the 2025 IHE North American Connectathon Week will not only bring together industry solution developers building modern healthcare digital solutions, but also government leaders learning about what is possible to achieve with interoperability and modern healthcare digital solutions. On this webinar, you will learn what activity streams we are planning for the Connectathon Week in February. Canada Health Infoway, we thank you for bringing the 2025 IHE North American Connectathon Week to Toronto this February. And with that, I'm going to pass it over to Attila.
Hello, everyone. It is my great pleasure to be part of this webinar today. It is the beginning of many. My name is Attila Farkas. I'm the Chief Interoperability Strategist at Canada Health Infoway, been part of the interoperability journey for pretty much my whole career, at first in the vendor space and then later joining Canada Health Infoway. So I fully appreciate the value that IHE interoperability can bring to the industry and to the table. So with that, if we go to the next slide, I would like to introduce the opportunity that we have a beautiful venue in downtown Toronto for this particular event. We tried to sneak in a summer picture here, but for those of you that have been in Toronto before, don't be fooled by the beautiful sunshine here. February in Toronto is not much better than February in Chicago. Maybe you're not going to get quite the winds that you get in the Windy City, but it certainly could be very cold at times. The good news is that the venue is hosted at the Intercontinental Toronto Centre, which is smack downtown, very close, walking distance to Union Station. Union Station is connected by fast train to the Pearson International Airport. And we chose this venue because we wanted to make sure that it is very easy to travel to Toronto and to reach the venue without having to pack your big park unnecessarily. The venue is state of the art. It has a lot of very elegant meeting rooms, and we're hoping that we're going to have a vibrant community of implementers working on parallel opportunities. As you'll see throughout the webinar today, we have an intense program. Not all streams are fully defined yet, but we are very close to giving you a very, very interesting programming for the week of 3rd through 7th of February. So once again, thank you very much for coming to the webinar, and hope to see all of you in Toronto in February. With that, I'll turn it back to the team.
So on this slide, we've got the Connect-a-thon week at a glance. We're very excited to have a few different testing options here. We'll have your traditional North America Connect-a-thon full week of testing. Very much looking forward to it. This year, we're also bringing a Pan-Canadian Project-a-thon, and we will have an IHE North America Plug-a-thon. We're also going to have 2 days of experience days, a briefing for newcomers, and a masterclass with a report out at some point on the learning sessions that are happening on the testing floor, so everybody can hear the great stuff that's happening. More to come on all of this, and I will turn it over to my colleague, Chris Carr, to give us a history and introduction of IHE.
Good morning or afternoon, everyone. Welcome. Happy to have you here and pleased to speak with you about IHE. And we didn't do any level setting with our audience or anything. So this is really geared mainly towards those of you who may be less familiar with IHE. And I'll just kind of start with the basics. So IHE is an international standards development organization, and we engage in profiling, which we'll say more about what that means in the IHE context, but it was founded in 1999, the last millennium, and by RSNA and HIMSS, and has expanded to have stakeholder organizations as sponsors and benefactors across North America and throughout the world. We develop technical specifications, which are called IHE profiles, to help health organizations achieve interoperability. Do that by promoting the coordinated use of established standards to address specific clinical needs to improve patient care. And just to kind of state the boilerplate vision, enable seamless and secure access to health information to improve patient care, to make that information available to care providers and patients when and where needed. And we do that by providing specifications, tools, and services for interoperability. Next slide, please. The benefits of using IHE and being engaged with IHE, we create these profiles which provide workflow-driven, standards-based interoperability solutions And we make those technical specifications available under free, unrestricted copyright license. So there's no tariff involved in implementing IHE. Those profiles, again, describe how you use established standards. So IHE is based on and relies on underlying standards, including HL7, HL7 Fire, DICOM, W3C, various security standards, and shows how you put those together. Really provides implementation guides for how to create, enable consistent implementations. Those specifications are vetted through an ISO recognized process. IHE is a liaison A under ISO's structure. And that process is intended to lower barriers and for integration to achieve interoperability and to, again, create seamless and secure access to health data. And really the upshot is that IHE, using IHE, helps reduce the costs and the risks for implementers, and that's both vendors who are developing systems and care sites who are purchasing and integrating those systems. And it does that by defining interfaces that, again, use established standards. Next slide, please. These documents, IHE profiles, which are, in some cases, documents, physical documents, but more and more are online implementation guides. They provide a common language for purchasers and vendors to discuss the integration needs of healthcare providers and the integration capabilities of IT products. And the language is based on actors and transactions. So it defines a set of functional actors that are included in a given use case, and the transactions and protocols for those transactions, and the protocols for the data objects they exchange, and puts that all together in an easily understandable, standard, consumable form. And that offers developers a clear implementation path for communication standards that are supported by their industry partners. Again, they're carefully documented, and these technical specifications are constantly reviewed and updated and tested. And we'll say a lot more. Obviously, the focus of today's call is on a testing event. And that gives purchasers tools that they can use to reduce the complexity, cost, and anxiety of implementing interoperable systems. It gives them language they can put in their tenders, and that they can hold the tendering vendors to when they purchase systems. So next slide. I think I hand it over to Daniel Berziano now, and he's going to talk about the Connectathon and Plugathon testing.
What is the Connectathon? I like to say that the Connectathon is a big LAN party. In reality, it's a cross-vendor, because we're doing peer-to-peer testing. You are testing against your peers, the people that you will be sending and receiving information from in the real world. Live, because the objective is to do this in person. We have sometimes had some folks remotely, but those are exceptions. Quality controlled, because they are managed by experienced, neutral technical experts and robust and supported by robust testing tools such as Gazelle. I'm the product manager of IHE Gazelle, by the way. It is also structured testing. So these tests are done in a specific fashion. You need to test with a minimum of 3 of your peers in order to get credit for that test. Also, there's a certain number of tests that you need to do in order to get credits for a specific profile. There's no limit on the number of tests besides the time. This is a week-long event, so there is a lot of time dedicated to testing with your peers. It gives a very collegial atmosphere where you and your peers or your competitors are working side by side trying to solve interoperability problems because they occur. And when they occur in the real world, we're looking at perhaps 2 to 3 months to solve something that's in production. You can solve this in hours at the Connectathon beforehand, before going into production, making the whole process of interoperability a lot smoother. And this is as close as we get to real world adoption for standard-based interoperability for the vendors and for the users. These events have been held since 1999. We count over 800 companies that have participated in a total of 80 Connectathons over the last 25 years now. So this is a well-run process that has a lot of experience, and it gives you also credibility. We issue badges that are credibly certified that you can use to also display that you've gone through the event and that you have passed specific profiles and that you've attained the degree of interoperability that is searched in specific buyers or large opportunities. They're held in Asia, Europe, and North America. We've had some in Australia in the past and different countries as well. These 3 are currently the ones that are being held on a regular basis and that we're involved in. And so the Connectathon is your gold standard for interoperability. It does require some work, depending on the profiles you want to do. There's pre-tests, so you do some offline testing before you go to the event so that everybody is at a level set that we can start testing together. This is not a hackathon. You're not going there to develop your product on the fly and try new things. You do that beforehand. You have all the pre-Connectathon tests that ensure that your partners have the basis of this almost works. And then once you start testing with your peers, then you can adjust for the small deltas that there are. Can we go to the next slide? So the North America Connectathon, you're thinking you might be coming back for your 24th Connectathon, or this might be your first one and you're wondering whether you should go to Europe or Asia. I typically say that if you want to conduct interoperability in North America, you should come to North America. Usually we have vendors that only do business in North America. They're in North America. And then we've also got some international players that come here. And depending on the years, different systems show up in different regions and different amounts of systems. So I think you can do all 3 and you would still always find new things that you can improve in your system. But North American Connectathon is specifically for North American industry that you want to carry out exchange with your systems. It's meant for international vendors. It's meant for specific domains such as radiology, infrastructure, devices, and so forth. We are looking to host a large Connectathon that has room and provides testing for all the interested domains. We're going to hold another webinar with more detailed information on this in September. I believe the date is on there. And this is in a nutshell what a Connectathon is. I want to move to the Plugathon that we also mentioned earlier. On the contrary to the Connectathon, the Plugathon is less structured. I wouldn't say unstructured, but is a testing event dedicated to specific context. And it also incorporates a unique learning opportunity that leverages some of the IHE experience as well as some of the well-established IHE Connectathons. It provides a platform for a specific community to innovate, and then often on the fly, you can conduct testing with APIs and health products try to get it done in a standardized way. To give you a better idea, in Europe, we recently had a plugathon, and there was a IHE fire track. In that track, it was an alternating of education on IHE fire profiles and then hands-on testing with these profiles. So people that are a more developer or that just want to learn more had the opportunity to come together in that space. And this can be done with more mature standards as well as standards that are in trial implementation, that are in development and so forth. We also have interest from the device community that is looking to advance their testing for SD-Pi, for instance. More details will come on the specific tracks for the plugathon, as well as the sponsors' opportunities and other pertinent informations. And so the plugathon is kind of a lot smaller in sense that it's not structured in the same way and it's not as formal. There's no badges, but it gives you a very good opportunity to do hands-on testing with IHE profiles. I will pass the microphone to Attila. I think you'll talk about another event that we're having also during the Connectathon week.
Absolutely. Thank you for that, Daniel. If we go to the next slide, I'm going to talk to you guys a little bit about the Projectathon. Projectathon is not new to our European colleagues, but I have to say the concept of a Projectathon on the North American continent is a little bit of a novelty. Canada Health InfoWay has been promoting this type of testing in Canada. We had 2 Projectathons run in 2022 and 2023. Both of them were virtual. So they're probably flying a little bit under the radar of most organizations. But if I were to draw a parallel between Projectathons and Connectathons, they're very similar in nature. I'm not going to read out what's on the screen, but the way you should think about Projectathons is a Connectathon organized around local realm challenges. So, for example, if a country or a territory province requires an integration of integration profiles and is confronted with some local challenges or variations that are not so customary in other parts of the world, what happens is you have an opportunity to use the concept of a Connectathon, apply it to that local realm, and it helps you with both developing integration profiles for that particular realm, but more importantly, taking catalog IHE profiles, so the ones that you saw in the Connectathon page that Daniel talked about, and showing how those international integration profiles can fit into your local realm so that you're solving matters of interoperability using international standards. So Projectathons do not rise quite to the level of quality label that Connectathons have, given that Connectathons test integration profiles that have gone through a very rigorous SDO process, as Chris has mentioned, and they're most of the time trial implementations or final text. Projectathons do offer the opportunity for a local integration profile development to test out integration challenges locally, as well as to help vendors get up to speed and adopt the integration profiles that are recommended for that particular realm. So that's the main difference between Projectathons. They run in the exact same configuration as Connectathons do. You're going to see peer-to-peer connectivity. Everything that Daniel said about Connectathon applies to Projectathons as well. The same type of setup applies. Usually their scope is significantly smaller than the IHE Connectathon, and that is primarily because you're focusing on satisfying a program that is going to use these particular integration profiles. Case in point, in Canada, we're in second year of developing and implementing a so-called Pan-Canadian Shared Interoperability Roadmap. A number of services described in the roadmap that we call building blocks, such as digital identities, identity federation, consistent FHIR exchange of data, data models, service directories, and the like, are part of this roadmap. And we are using the Projectathon to test integration in these particular verticals. We had really good attendance last year in 2023 for relevant areas. If we go to the next slide. For relevant areas that are very close to the Shared Pan-Canadian Interoperability Roadmap. As you can see there, we have a little bit of a graph here that represents the results of the survey that is currently open, that is asking the community what interest would they have if they were to participate in the Projectathon. And what you're seeing there preponderantly, there's a very big focus on the Canadian FHIR exchange specification. This was developed about 2 years ago in an attempt to help the country adopt the International Patient Summary implementation. You see the specification that is the Canadian Instructions for Adoption of IPS called Pan-Canadian Patient Summary, PSCA. Part of the roadmap is also focused on e-referral and e-consult. We have care service directories and something that we're working locally on called Health Application Lightweight Protocol. It's shortcut HALO. These are examples of activities that are very close to our heart because jurisdictions, provinces, and territories are feverishly working on implementation and adoption of these capabilities. And so these are the typical specifications that you would see tested in the Projectathon. Now, for those of you that have been part of this, you remember that we have also made the Projectathon focus on IHE International specifications directly from the website, IUA, MHD, Aetna with the CA-SAC, CA audit were part of the Projectathon in both 22 and 23. And we have a link here. We have a Confluence site that presents all the specifications that I'm just mentioning here. And there's a page there that describes Projectathons in significantly more detail, gives you links to the simulators, validators that are being used in combination with Gazelle. And these resources are usually assigned so that vendors can get ready for participating in the Projectathon. So more information will come very soon. The survey is still open and the market is responding to these things. We're coming out of summer, so it's natural that you have a little bit lower attendance to some of these events, but we're confident that getting into September, you're going to start seeing significantly more activity. And by October, we'll have a webinar dedicated specifically to the Projectathon track with very clear specifications with version numbers and links to the specification posted so that vendors can get ready for the Projectathon part. And with that, I'll hand it back to the team.
Thank you, Attila. Christina back. Emily, could you please go to the next slide? Now that we've learned all about the great testing options that we're going to have at the Connectathon, I'm going to shift gears a little bit. And I'm really happy to share that we will be having another North America Experience Days. This is more of our conference style. opportunity to learn and network with your colleagues across the globe. It is intentionally designed to be accessible to all. So it's our part of the Connect-a-thon that is not just our technical folks, but will definitely include some of our technical folks, but also our decision makers and business folks and others who are really trying to advance digital health. So we are really looking forward to curating some great topic content with industry leaders, government leaders, and showing a lot of successes both at the local and global level. I like to say that at the Experience Day, we really start the magic of Connect-a-thons. We share our experiences, we learn from others, and we work together to identify the newest problems and challenges that we can start to tackle as a community to then have action items and next steps. We've seen out of our Experience Days topics being discussed that over time have become the next profiles that we've developed and tested. So really, really important 2 days for us to collaborate. We've started to think of some topic areas of interest. If there's anything you'd like for us to consider on the agenda, throw it in the chat, or we can definitely talk about it in our open discussion. We will have more details on the full agenda of this coming out soon, so keep your eyes and ears opened. With that, we are going to go into the Q&A portion of our agenda. Feel free to come off camera, stay on, and have a conversation with us with any questions or anything else. And if people would feel more comfortable putting questions in the chat, we're also monitoring that. Are the Experience Days in Toronto as well? Yes, the Experience Days are going to be happening at the same time as the testing at the Intercontinental in downtown Toronto. We also, for the Experience Day, have a VIP tour where we take our Experience Day attendees on a tour of the Connect-a-thon floor so that everybody can kind of see what's happening on the floor and understand it. It's really, really been well received by attendees, and we look forward to it every year. Are there any issues with getting equipment to Canada from the US? We were looking into that and getting, we'll have information put on the website with a Q&A, unless any of my other team members have gotten an answer on that to date.
No updates, but we are looking into the process, and there'll be some paperwork in advance, and it'll be coordinated with border control.
Thank you, Daniel.
There's another question that came in. Will there be any way to monitor confirmed organizations participants as we close in on February?
Yes, and others, please feel free to chime in on the team, but we will be monitoring and making sure that we have enough testing partners for any profiles that are being tested. If we see any red flags, it will be communicated to vendors. The last thing is we want is for anybody to show up without enough testing partners. So we will be working to ensure that we've got some robust testing. I hope that answered the question.
And while we wait for more questions to come in through the chat, any questions that are not answered, please feel free to check in on the IHE USA website. We will be updating that with, upcoming dates, timelines, anything like that that you'll need. We also have our LinkedIn page where we post regularly on any updates. And then any additional questions, anything more specific, you can always email the email on the screen, and we'll get back to you.
Can we participate as a group to learn, even if we did not want to actively participate in the testing?
Yes, that can be done as well during Projectathon or experience days. So depending if you want to have more of a hands-on kind of a developer view of things, or if you want to understand the IHE profiles at a high level from a business perspective. Yeah.
Absolutely. And if I may just add to that, so the Plugathon is also new for North America, and you should think about it in a way where this could be the innovation track of the future that's going to give attendees the opportunity to chime in with their area of expertise, but also learn from others that have it on topics of the highest importance and the most stringent for interoperability. So if you don't have a solution that's running yet, but you're interested in, for example, a patient-mediated access to their health record or AI-assisted communication chains, digital identities, federation, whatever the track might be at the Plugathon, you can absolutely participate. And you can also participate in the experience days to learn maybe the processes that are there, about masterclass on how these things are done at scale. So there will be opportunities to participate, even if you do not have a system that is being tested in Connectathon or Projectathon.
And I see, what is the name of the LinkedIn group? I'm assuming this question is to where to monitor different things. We'll have a couple handles. The main source of, just because of our historical participation with the Connectathon, and the fact that people look for it on IHE USA website, we're doing most of the registration and LinkedIn off of IHE USA's website. But you can also, I would recommend also following LinkedIn for IHE USA, IHE Canada, Canada Health InfoWay, IHE Catalyst, and IHE International, and we can send some of those links around. Thank you, Emily, for dropping in IHE USA's LinkedIn page.
Oh, and thank you, Sam, for adding the. We have a new question. Will we be concentrating on just IHE or also exploring IEEE 11073 SDC protocols?
Daniel, can I pass that one to you?
Yeah, I think this is a specific question for the device group. I would defer to the TPM there, but I could take it down and get back to you offline. I don't know that by heart.
Daniel, would you mind dropping your email in the chat so that he can have a way to communicate? Or you can also send it through the email provided here on the screen.
Could we also, whatever the answer you get on that, Daniel, could we actually put it in as part of our FAQs or follow-up questions for the general community?
Absolutely, yeah.
Thank you.
I will just say to that, sorry, this is Chris Carr jumping in, even though I'm not an expert on the device domain, that some of the, like the service-oriented device point of care interoperability, SDPI profile work, incorporates, it really addresses the application of 11073. So they're not exclusive alternatives, the IHE and IEEE. There are profiles in the device domain that address the implementation of IEEE 11073 specifically.
Yeah, and I talked to the device group, I think it was last week, and at this point, they're doing SDC. They want to participate at the Plugathon, but I'll let you know as that evolves. Yeah.
Yes, and I that Victoria, that expresses my understanding of it, roughly speaking, too.
Yeah.
Excellent. Do we have any additional questions? We can stick around for a few extra minutes, but how do we register for specific events such as Experience Day? Registration will be opening on the IHE USA website. System registration should open around September 9th, and we will be sending dates on how you can register for the other events as well. If anybody has additional questions, please feel free to email us at connectathon@ihe.net, and we will get back to you. With that, seeing no other questions, thank you all so very much for joining. And we are looking forward to seeing everybody in Toronto in February. Again, the team will stick around for an extra 5 minutes, but with that, we'll close the webinar. Thank you.
Thank you, everyone. Bye-bye.
Emily, I think we can stop the recording.
So